really nervous about this appointment. I haven't been to a doctor in years. But finally, I have health insurance. I chose Dr. Miller because he is in my network, but I don't know anything about him.
As a transgender woman of color, Vanessa Shepard has had mixed experiences with doctors and hospitals in the past. But it's the bad ones which stand out in her mind today. So she enters the office with trepidation. Immediately upon entering, she begins to scan the environment for clues. Will she be welcome here? Will she be safe? Do the posters reflect a diverse patient population? Is there a non-discrimination policy posted? No, there is not.
Hi, my name is Vanessa Shepard. I have a 10 o'clock appointment with Dr. Miller.
Looks like this is your first time here. Please fill out all the pages on this form. Bring it back to me when you're finished.
Thank you.
Intake forms are a powerful and early indicator of the safety and welcome LGBT people can expect in a healthcare setting.
What am I supposed to do here? Do I have to lie, or how truthful can I be? Name? I'm just putting Vanessa. Sex? Only 2 choices? I hate this. I guess I have to check male, the sex on my insurance card. Relationship status. With these options, I guess I have to choose only single.
Thank you. Can I have your insurance card, please? I have to make a photocopy of it. You can have a seat and I'll call you. Would you come here, please? You gave me the wrong insurance card. This one says Robert Shepard.
I used to go by Robert Shepard, but now I'm Vanessa Shepard.
So Robert is your real name, and that's the one we're gonna have to use. Have a seat. The doctor will call you.
Mr. Shepard? Mr. Shepard?
That's me.
I called for Mr. Shepard. You are?
I'm Vanessa Shepard.
Okay, come in.
Vanessa is humiliated. Now let's see how it could be done better. Vanessa scans the walls upon entering the waiting room and immediately spots a non-discrimination policy, and yes, it includes both gender identity and sexual orientation.
A rainbow sticker, yes. Oh, and they have the advocate? Great. Hi, my name is Vanessa Shepard. I have a 10 o'clock appointment with Dr. Miller.
Oh, looks like this is your first time here. Please fill out all the pages on this form and bring it back to me when you're finished.
Thank you.
It's immediately clear that this intake form reflects a medical practice with a diverse clientele, and that the providers here want to know who their patients are. The form has a place for Vanessa to write her legal name and her preferred name. It has more than 2 sex options, and a place to indicate she's in a committed relationship.
All done?
Thank you. Can I have your insurance card, please? I have to make a photocopy of it. Have a seat. The doctor will call you.
Excuse me, Ms. Shepard? Hi,
Hi.
welcome.
Thank you.
Come on in.
And now the appointment begins. These first interactions with the provider subtly indicate to LGBT patients whether they can be open or need to be guarded. Let's see what happens between Dr. Miller and Vanessa Shepard.
Just to get started, I saw on your intake form that you did not check off when your last period was.
Yes, I'm a trans woman and I don't get a period.
Oh, so that means you've had the surgery then, right?
No, I don't know what surgery you're referring to that would make me get a period.
Okay, so you have sex with men, which would just mean that you're gay.
No, I'm a woman of trans experience and I identify as lesbian or bisexual.
I have no experience treating patients like you. I really think you need to be seeing an endocrinologist and not me.
Well, I only came in here because I've been coughing for 3 weeks.
This is not going very well for Vanessa. Now let's see what an LGBT welcoming provider might do differently.
I see that on our intake form you checked off that you're transgender. Do you prefer to be called Ms. Shepard?
Yes, I prefer to be called female pronouns, please.
Okay, great. So sorry I got it wrong in the waiting room. Thank you for your patience. Do you currently have a healthcare provider who's providing you with your hormonal treatment?
I do go to a clinic, but it's really far away, so I was hoping that I could do everything today here with you.
While I have experience with the LGBT patient population, I've never been the provider of hormones for a transgendered patient. That said, I think it won't be a problem. I've prescribed hormonal therapy to other patients, and as long as you're willing to be patient with me and we work together, I think that should be okay. The other thing before we get into what brought you in today is I always like to remind my patients how important it is to be tested for HIV. Can you tell me when the last time is that you were tested?
Dr. Miller knows that transgender women of color have particularly high rates of HIV infection due to multiple barriers to care and discrimination. And many HIV-positive women have never been tested.
Okay, so now that we got that out of the way, tell me what it is that brings you in to be seen today.
Well, I've been coughing for 3 weeks. What a terrific doctor. This could be the beginning of a long relationship.
As we've seen, a doctor's appointment is a complicated set of interactions with the environment, with forms, and with the healthcare staff. There are many places to get it wrong and many opportunities to do it right.